Hi, class. It's Dr. Lindner. Let's take a look at some of the accessory structures that we find in the skin. So, um, we have hair, right? We have hair in the skin. It's present on most body surfaces, except the palms and the palmar surface of the fingers, the soles of the feet, and the plantar surface of the feet. It's composed of dead, keratinized epidermal cells, and there are genetic and hormonal influences that determine the thickness and the distribution of our hair. So the human body is covered with hair, except, as we just said, the palms, the soles. Thank goodness we don't have hair on our lips. That would make shaving very, very difficult, wouldn't it? And then portions of the genitalia. So what's the function of the hair? Well, it protects and insulates us. It guards the openings against particles and insects like the nose and the ears. And hair is very sensitive to very light touch. And I know that it's somewhat trendy to shave and remove all the hair off the body, but it's part of the neural system. You want that hair. It's part of the primitive response that lets you know, are you in danger or not? Is there an insect that's crawling on you or not? So hair is very, very important. Um, if you look at the native Indians, they know that, right? They know the importance of having long hair. Many won't even cut it. So when we look at the skin and we look at the accessory structures, right? We have some glands. We have a sebaceous gland, which is your oil gland. We have a sweat gland, which is a sudiferous gland. We have the erector pili muscle, and this pulls on the bulb of the hair so that your hair can stand on end, right? When you're in danger, it kind of gives you the goosebumps. So the erector pili is smooth muscle in the dermis, and it contracts when it's cold out or in fear. And that's what forms the goosebumps. Think of what happens to a cat when it's scared, right? The hair stands on end all along its back, right? Animals puff out, their hair stands on end to make them look bigger than they are, part of that sympathetic response to try and scare another animal. Okay. And you can see the hair root plexus, you can see that they're highly innervated with nerve supply so that it can detect the lightest movement on the hairs. So down at the bottom is the hair root plexus. You could see as you start to move upward, way to the surface, there's the exposed shaft of the hair. Here is your oil gland, your sebaceous gland. So your sebaceous gland secretes oil, and these oils move up, and it creates this like water resistant and waterproof seal around this area. And the oils also have a lot of antimicrobial and antiviral factors in it that act to protect the skin, right? It prevents debris and particles from getting in here that can create infections. So the oil gland or the sebaceous gland is very, very important, and it keeps the hair nice and lubricated. The erector pili muscle, that's the smooth muscle. So when this contracts and pulls this way, right, the hair stands on end. When you're cold or in fear, or someone just takes their nails on an old-fashioned blackboard. So the hair prevents heat loss. It also decreases sunburn. It protects us. Our eyelashes can protect the eyes. There is a reflex called the corneal reflex that involves cranial nerve 5 and cranial nerve 7. When something touches the eye, cranial nerve 5, when something touches the cornea, cranial nerve 5 is the sensory part that picks up that something like an insect touched your eye. And then cranial nerve number 7 is the motor part that actually shuts the eye to push out whatever entered the eye to push it out. So that's called the corneal reflex. It's cranial nerve 5 and cranial nerve 7. 5 is the sensory part, and 7 is the motor part. Remember, 5 is the sensory because you have your eyes, your nose, and your mouth, right? And cranial nerve 5 is called a trigeminal. Tri, 1, 2, 3, because there's 3 divisions to it. Cranial nerve 5 has a V1, a V2, and a V3. V is for Roman numeral 5. So there's 1, 2, 3 divisions, trigeminal. V1 goes to the ophthalmic, goes to the eye. V2 goes to the upper jaw, and V3 goes to the lower jaw. When your dentist hits you with Novocaine, half your face goes numb, including your tongue, your gums, and your eyes, and everything. So when 5 is stimulated, we know something touched the eye, and then 7 makes you blink. Okay. We have eyebrows. Eyebrows, these are important because as sweat comes down, right, it's kind of like a gutter, right? As sweat comes down, it rolls off the side of your face, but also as UV light comes down, it hits your eyebrow, which is typically darker, and protects your eyes, which is why when people play sports, they put the eyebrow underneath as well, so that the UV light scatters above the eye and below, protecting the eye from the sun. Um, the hair has these touch receptors, so we can even sense the very, very lightest touch. And there is a normal degree of hair loss throughout the day. Typically around 50 hairs is considered normal, healthy loss because you do lose hair and your body makes more. It's when it's excessive like this, when you start to see this patching or alopecia, then we know something's going on. We could see it with iron deficiency. So we always want to get your blood checked. You want to look for iron, but you also want to check ferritin, which is iron in storage. So if ferritin is too low, that can certainly result in this. And also thyroid issues. Thyroid issues can create this. And if you look at the eyebrow, you'll see that the lateral 1/3 of the eyebrow is missing. That's very, very common in thyroid issues. Okay. So eyebrows are a good indicator of thyroid issues. And also, we know as a result of COVID, which is very stressful to the body, COVID has known to create some autoimmune issues against the hair follicles. And it just takes probably 9 months to a year to go through the vicious cycle of losing a lot of the hair, but also growing it back. I've never seen a person go bald with COVID, but I have seen people, especially women, that get this patchy hair loss, an excessive amount of hair loss that's in the shower and the sink in the morning. And the women get very sad and very depressed when they see that. And they try and do everything nutritionally, and it just doesn't seem to help because it has to go through the hair cycle, the lifespan of that. And it could take 9 months to a year to really see the change. So lots of different things. There's also eating disorders can create hair loss, protein deficiency can create hair loss. So you really need a good hormonal panel, and then look at your thyroid numbers, do a nutritional panel, look at your iron and ferritin, look at your antibodies, and have a very comprehensive, holistic approach. Now, in terms of the oil glands and some of the glands that we see in the skin, so the sebaceous gland is your oil gland, and that's a holocrine secretion, or known as a holocrine gland, because the entire gland itself becomes the actual secretion. Okay. Um, sebum, sebum is the combination of cholesterol, proteins, fats, and salts. The sebum is actually that oil. Okay. And it keeps the hair and the skin soft and pliable. And as I mentioned, when that sebaceous gland secretes its byproducts and moves up the shaft of the hair and goes on the skin, there's antibacterial properties to it. It can inhibit the growth of bacteria and fungi like tinea, like ringworm. Okay. The sebaceous gland forces lipids into the hair follicle and into the skin, and it creates this watertight seal, preventing infections. When we see acne, well, that's a bacterial inflammation of the sebaceous gland. And it can be a sign of a fish oil deficiency, especially eicosapentaenoic acid, the EPA, right? When you look at omega-3s, you'll see that there's EPA and DHA, eicosapentaenoic acid and dexahexaenoic acid. And we know that during puberty, hormones can actually make acne worse. Okay. Now, merocrine glands, which are sweat glands, these are found in most areas of the skin. It's the secretory portion in the dermis with ducts to the surface, and it's designed to regulate body temperature. It does so by perspiration. The apocrine gland is the old name, and now many textbooks refer to them as merocrine glands, which are sweat glands. And you even have them in the armpit and in the pubic region. And because these areas are closed off and it's dark and there's not lots of airing out that takes place, the secretions in these areas tend to be more viscous. And the sweat that is produced there tends to be nutrients for bacteria, which intensifies the odor. So the odor is coming from the bacteria that's formed in that more viscous area, and the bacteria gives this byproduct of the odor that most people refer to as BO or body odor. And when people put antiperspirant that's there, you have to remember that sweat pores stay open because there's like charges, right? There's always these like charges, these positive charges around. And we know that when you have two positives, they repel, they pull away. They pull away, the gland is open. But when you put antiperspirant, you start adding some negatives in there. Positives and negatives contract. So this opened sweat gland becomes very, very narrow and closed, and you won't perspire. That's the concept to it. That's why they have aluminum that they add there. You're adding these negative anions, and when it connects with the positive ones on the skin, it closes it off as a antiperspirant. The problems with aluminum is when you constantly use these deodorants with aluminum, remember, anything that goes on the skin, your body can absorb. And if you get high aluminum, you get these metals in the system. The neural system doesn't like it. The brain doesn't like it. So when we see people that have neurological issues like Parkinson's disease, we have them remove using any type of deodorant with aluminum. We obviously check their metals in their blood. We check their aluminum. We check the nickel. We check for copper, cadmium, cobalamin. We check for a lot of different mercury, cyanide. We check for a lot of metals. It's very important, even if you have silver fillings, which are loaded with mercury, to get those properly removed by a dentist who is trained to remove them. You just don't want to drill out a silver filling and inhale all the mercury filaments into the bloodstream. Now, ceruminous glands, ceruminous, this is in the ear, right? This is producing waxy secretions in the ear canal. And this helps to form a barrier against, insects and spiders and things that like to climb in there. I've seen these horrible videos of it, very freaky. If you have too much wax buildup, you can get impacted cerumen, and that can certainly affect and reduce the person's hearing, meaning they'll hear you. It'll just be very like it sounds like you're underwater in one ear. It can sound louder in the obstructed ear. So if you cover your right ear and you talk as you or hum, you'll hear that the sound lateralizes to the blocked and obstructed ear. But you just can't hear what you're saying that well, but it is louder in that ear. So you want to be careful, especially with children when they're having trouble with hearing. You always want to inspect the ears, take a look, and make sure it's not wax accumulation and blockage. If so, you'll go to an ear, eyes, nose, throat specialist or even a pediatrician to remove some of the accumulation. Now, the mammary glands, these are going to produce milk, and they're found in both sexes, but they're rudimentary until puberty, meaning with estrogen, they develop, but with testosterone, they are inhibited. Now, there's a big movement where everyone seems to be smoking lots of marijuana these days. I'm driving my vehicle and I can smell it everywhere. I smell it in the classroom sometimes. It really does surprise me. When I go to the gym, I'll smell people that just, smoke in the car, come into the gym, and it's what they do. But keep in mind, marijuana in men is known to decrease testicle size. And if you decrease the testicle size, you decrease testosterone and increase estrogen. And that will increase the appetite. We know that people that smoke marijuana get the munchies. So it increases the appetite, which increases fat cells. Now you got a gentleman or a guy who is now smoking, has decreased testicle size, decreased estrogen, decreased testosterone, I mean, increased fat cells, which increase estrogen, right? Fat cells make estrogen. That's why when women go below 6 or 7% fat, they don't get their menstrual cycle. They get amenorrhea. So fat is metabolically active and can produce estrogen. But men, when they decrease testes size and increase estrogen, they get gynecomastia, which is breast tissue. So I could pretty much pick out in my classrooms who the marijuana smokers are, okay, just based on body composition. Now, in terms of type of hair, there's hair that's called lanugo, and that covers the fetus. Then there's terminal hair, that's long, coarse, and heavily pigmented hairs. And then there's vellus, which is short, fine, pale hairs. These are just different classification of the different types of hair. And in terms of hair color, it's primarily due to the amount and type of melanin that's present in the keratinized cells of the hair. Okay,